Thanks for tuning in to Healthy Planet One, where we discuss healthy living from experts in each of their fields. This is your host, Patricia Starr.
And your co-host, Kimberly Knox.
Today's guest on Healthy Planet One is June Drennon, and we're going to be talking in part 2 about thermography and really not only about the prevention, but what's the insurance piece, what's the whole overall aspect that we're looking at with the body and your many years. How many years experience?
Well, 2008. What is that? That's
it's about 12 years, right?
Mm-hmm.
Yeah. But you've been in practice for over 18 years.
Yes.
So you come with that background as a colon therapist and as a lymphatic drainage person.
Yes.
So that's really important because that's what thermography really can tell a lot. So let's go into that. I know one of the big questions that I get about thermography, not only what is it, and you've had a great explanation about what it is. Thank you for that. But does insurance cover it? And what do we do?
So I heard a great saying once, is that if you're relying on your health insurance for your health and well-being, hopefully you have a good life insurance policy. And I think that's pretty good because I have insurance, but I never use it because the things that I do are not covered. So it's basically there for
the things that you do for your health.
I do for myself personally. And, acupuncture, chiropractor, yes, colon hydrotherapy, lymph, massage, all of those things typically are not covered. But things are changing, particularly with people having the health savings account, HSA cards, because that gives a person a lot more flexibility, and I do take those. There are some more private insurance companies. Liberty is one of them that they're taking the insurance. Most of the conventional insurance companies don't, but many of them do allow it for the deductible. So when I send the report, I always include a paid invoice with the CPT codes that can be submitted for that deductible if that case comes down to it. Or sometimes when people have a lot of medical expenses, they can get a tax write-off.
Well, that's great because that gives people an opportunity to work their insurance, however, to support their health.
But change happens from the ground up. And so the more that people ask for thermography, ask their insurance companies to cover it, I do think it will change. As chiropractic care was not ever covered, and now as of the last decade, I think more and more companies are covering it. So, and acupuncture, as a matter of fact.
Florida has a little exception to that area, which is very, very frustrating for me. And and Kimberly, I know you as a healthy food chef and educator, it would be wonderful if you were covered with some of the insurance because really health starts with food and how you're
and elimination.
I think they're trying to get health coaching. They're actually in Washington today through the school I graduated from, the Institute of Integrative Nutrition, pushing for it because today is Health Coach Day. To have some of the dollars from the HSA help to cover health coaching because it's very effective.
Health Coach Day, I love it.
Absolutely.
So what if your doctor doesn't accept thermography? What do you do about that?
Well, one of the things I'll say is
they need to be educated.
Well, they do. That's a big, I can talk all day on that one. But not all doctors can read an x-ray, but all doctors can read a report written by a radiologist. So the doctor that does the interpreting for me, Dr. Christine Horner, who I mentioned, she was a breast cancer specialist surgeon for 20 years in Cincinnati and became frustrated with so many young women getting breast cancer that she decided to focus on prevention and became an interpreter. Would be similar to a radiologist. And so her report the report in the thermography is written by a medical doctor that has a good perspective on both conventional and functional.
That's all the reports that come from your imaging, correct?
I use her. Now, the company I image that does my interpreting is Physicians Insight, and they have quite a few very qualified doctors on staff. The reason I use Dr. Christine Horner is because I know her. We have a rapport. Sometimes I have questions. It's just easy.
She's a woman. I think that's helpful.
Yeah. And then I love it that she has the perspective of both, as I said, the conventional and the functional. So if your doctor does not accept it, just have them read the report. And if they still don't accept it, maybe they're not keeping up with the times. But there are a lot of doctors out there that do, and maybe it's time to switch up to someone that understands a more holistic view in prevention. And as doctors see this happening, not just in regards to thermography, but in everything, I think a lot of them are starting to add functional classes and education.
They want to be functional because
they want to be up to date.
Yeah.
Mm-hmm. But I will add that no matter how great your tool is, if you don't know how to use it, it's not effective. So it is important that you work with someone that will work with you. In our cover letter, when we send out our reports, we say if you don't understand your report and you don't take action with the suggestions, you've wasted your time. So I am available, and Dr. Horner will also do consultations if you don't have a doctor or practitioner you're working with, to help you understand what the report means and how to move forward with it.
Mm-hmm, mm-hmm. That's so great, really great. I know that when I was dealing with my breast issues, mm-hmm. I wanted to work with a woman mm-hmm. because she's got breasts.
Yeah.
And there's a knowing there. And it was very traumatic for me when I went through the second time. I looked all over for a woman on the mm-hmm. East Coast, mm-hmm. found one, but then she sent a young male doctor in to do the needle biopsy. And mm-hmm. It was such a traumatic experience mm-hmm. because he was just not kind and mm-hmm. blah, blah, blah. So,
but
it's nice to know that women are stepping forward and really looking a lot deeper than just saying, you got breast cancer, because as I understand it, breast cancer statistics have not changed in terms of all these years.
Which is a whole other story about the think before you pink, which is think about where you are donating your funds to this whole breast cancer money train. Mm-hmm. And some of them are doing excellent work and really helping make changes, and some are just leaving, the money's going to the pharmaceuticals, and they're still doing the same exact thing that they were doing years and years ago.
And I understand what's the average number of breast cancer deaths in the United States?
I don't really know that now.
I think Kristen shared mm-hmm. that it was like at 40,000, mm-hmm. and it hasn't changed at mm-hmm. all. Mm-hmm. But the diagnosis has mm-hmm. gone up, and there's where the 80% comes mm-hmm. in, has gone way up after mammograms started to be utilized.
And then also with that, like you said, I have seen patients that were stage 0. On their breast cancer, and they were strong-armed into having a mastectomy and reconstruction. And yep. Go ahead.
Yeah, well, I was just going to say yes. My girlfriend, I was going to share a story on that. My girlfriend's oncologist, her husband was a breast reconstruction doctor. I felt that was not appropriate, and she was strong-armed into it. And we will not make any changes in breast cancer until they address nutrition and liver and other things. Yeah.
Well, that's another thing that some of the doctors do on chemotherapy clinics. And it's like, that seems to be a little conflict of interest. But
what do they do in chemotherapy clinics?
Well, I mean, if the person that diagnoses you can financially gain from your treatment. Oh. So that, I don't want to get into the, conspiracy mm-hmm. thing, but, one of the things that I have said so many times, I can't tell you how many people have said, if I knew then what I know now. Cancers don't pop up overnight. Once you do get a diagnosis, you have time. You mm-hmm. have time to do some nutritional mm-hmm. things. An example I like to use, if you bought a pack of seeds and you brought them home and put them in a drawer, they're mm-hmm. not going to grow. But mm-hmm. if you plant them in the ground and give them water and sunshine, they grow. The difference is the environment. It's the terrain. So what is within your body, your terrain, that supports that cancer cell growing? And then when you change that, the pH and the, mm-hmm, mm-hmm. Every, food sensitivities, whatever you want to get into, inflammation, then your body can't continue to grow. So I've seen many women that have done the natural approach and been very successful with it.
I'm smiling because that's what they told me when mm-hmm. they diagnosed me a second time with breast cancer, that I needed to have a mastectomy and maybe take off my other breast too, just mm-hmm. in case. Mm-hmm. And It just seems so absurd when I think that was 25 years ago.
You were afraid, and they make you think you'll die tomorrow if you don't do something.
And what happened for me is I was like, this doesn't sound right. It sounds barbaric,
and it is,
if you will. So I actually called my initial doctor that I had 4.5 years earlier, and I asked her, how much time do I have? Because they wanted to do it right away, is how they do it. And they make you afraid. She said, you have 8 weeks. And I go, good. And I just went ahead and I studied and I read a stack of books about 3 feet high that I poured myself through and educated myself and realized that, wait a minute, there's a lot more to this than meets the eye. So it's really, to me, having gone through that experience has been a gift. That's why we do it in our office here, because this is a gift for women to come, particularly for women, to come and get their imaging. But I've also seen it work for little children that are 6 years old when they went to 4 doctors and they didn't know what the problem was, and they wanted to put a 6-year-old on prednisone when all it was his diet was really off. And there you go, Kimberly. We changed his diet to get him on vegetables, off of sugar, off of ice cream, off of all that stuff. And
sugar
he
feeds
cleared.
everything bad. Yeah.
What's that?
Yeah, the sugar feeds all the cancer cells. It feeds the inflammation. It destroys the lymph and the liver and more and more. So
well, what's so interesting is
we can see that change.
Scan. Well, I'm just saying a PET scan is they give you sugar and see where, and that's what that's all about. And so then they don't recognize that sugar contributes when it certainly does.
So we actually saw this on the thermographic image, and it just was very clear. And we're going to talk about that in a minute.
Okay.
And so then we changed his diet, talked to the mother, changed his diet. He came back about 4 weeks later. It was all clearing. I mean, and he was out of pain in a week. When changing the diet, but then you could watch it just clear, and then 2 months later it was done. It was all gone.
That's so amazing.
Isn't that cool? And then I've also worked with men where they've had surgery that's gone like across their abdomen, and that blocks the meridian flow. And you could also see he'd been experimenting with hormones without telling anybody, and that showed up in the thermography. So let's talk about all these different things that go on with the imaging and with the different aspects that you look at. We've got breast health is the one that was initially brought into play. But what are the other? You've got half body, whole body. What's the other way?
Well, the different imaging that we do is, of course, the breast, which is $200. And then we do what we call the health study. It's a men or women's health study, and that would be the head, the chest, and the abdominal area. So the head would look at thyroid, carotid artery, dental, sinus, cervical, myofascial, lymphatics. It does not see inside the skull. It's not one for like brain tumors or something like that.
But we can see inflammation, which I noticed.
Yes, I noticed in the forehead.
Right, in the forehead or the upper, under the parietal. So as a cranial structural therapist, for me, it's been extremely helpful because of that. I can see where there's inflammation in the head. And so I can, through the lymphatic drainage in the cranial work that I do, it changes that. And then also seeing the spine, because that shows up in the thermography as well. And I can see where there might be some areas that are compromised because of pinching going on or a twist going on that I can work out just manually.
Yes, and that, once again, that's the whole advantage of seeing what you're doing is effective. And there's referred pain. Sometimes I've had a woman come to me recently that had been in an auto accident, and all of her pain was on the right side, but the inflammation, the injury was on the left. I had a guy come to me that had been he couldn't count how many doctors because his face was swollen and broken out and a rash. And it turns out he had some severe dental infections, and nobody had caught that.
And the thermography showed that.
And he went to a holistic dentist and got what he needed to improve that. Once again, I can't emphasize enough the thyroid, how important that is, because that affects everything.
And that's in the health study.
Yes. Yeah, now we can do two regions. We can just do like head and breast, or breast and abdominal, or one, or or just one region. But the health study also includes the when we're looking at the chest, they look at the heart and the lungs. And for instance, I had a woman that came in with left breast pain, and they couldn't find anything wrong with her, and it turned out it was heart issue. And curiously enough, we see that from the